guys, welcome back to Medical Coding with Blue. Today's episode is all about the CCS or the CCSP. Which one should you pursue? If you're brand new to my channel, welcome. I am Blue, I'm a medical coder. Okay guys, so I got this comment. I'm going to read the comment and then we're going to get into it. So, here we go. Alright, so the viewer says, "Hi Blue, I'm so glad I found this video. I plan to become a medical coder. My initial idea was to go with the CPC from AAPC. However, after doing some research about what the local employers in my area are looking for, I decided to go with the CCS. I have just completed a 4-week medical terminology, anatomy, and physiology approach course from the local university extension. Do you think I can skip the anatomy and physiology and medical terminology instead of taking the full 13-course bundle from Ahima? Also, how do I choose from the CCSP or the CCS? Hope you or someone else in the comment section can enlighten me. Thanks." Okay, so this is my answer. I'm going to do this in a video version. So when it comes to if the person can skip that part, you only had a 4-week program from your college extension. So I would, me personally, I would go with the full 13-course bundle. However, I also have the independent study video that has all that stuff, you know, the medical terminology books and anatomy and physiology, pathophysiology books that I recommend. So you don't have to take the full 13-course bundle. You can do independent study on your own. To be able to be eligible to sit for the CCS or the CCSP, you just need a high school diploma or a GED, okay? You do not need experience. It is recommended, and for some people, they see recommended as required. Recommended does not mean required. Recommended means if you have it, great. If you don't, well, this was what we were telling you that you should have, okay? So with that being said, I would go into a little bit more of a deep dive than just 4 weeks, but that's just me personally. The link to the independent study video is in the description box below. In this independent study video, it lists a syllabus for being able to go through a program independently on your own. You do not have to go through a formal program. All the books that I recommend are the things that's going to be covered in the school anyway. So again, if you want to study medical terminology and anatomy and physiology on your own, pathophysiology as well, you can, okay? You can skip that part of the 13-course bundle if you like. You can buy the courses a la carte with Ahima, which means you can purchase them one at a time. You don't have to purchase the whole thing because with the books and with the cost of the program, it's a little under $5,000, okay? So if you don't have $5,000 right now, again, you can independently study or you can go through the Ahima program. Just know that the Ahima program, it does not have a live instructor, and these are mostly, from what I've heard, it's mostly like a lot of slide decks that you're going through. And so you're going through this at your own pace. Now keep in mind, if you buy the whole bundle, you get a whole year from the time you purchase it and, you know, to complete it. If you do not complete it, there is no extension. You knew that as soon as you signed up for it. So if you do not finish the program, that is on you. And basically, you just wasted your money. So if you do decide to go through that, make sure that you go through it and you stay on course, you stay on pace. If you're studying 20 hours per week, which it is possible, even if you have a full-time job and work and kids and family, it you know, you can still do it. But it's entirely up to you. It's an individual thing. So again, if that's what you want to do, great. But I will say this. Whether you decide to choose to go with the CCSP or the CCS. Now, how do we know which way to go? It's very simple, guys. When you look at the description of the credentials on the Ahima website, and again, that link for Ahima will be in the description box below. The CCSP, or the Certified Coding Specialist Physician-Based, is all outpatient coding. And what this means is that you must have a proficiency working with ICD-10-CM, that is the diagnosis coding, CPT, the current procedural terminology, and the HCPCS codes, okay? Those are the 3 books that you have to have when you go and take that exam, okay? And you have to know those. You have to understand evaluation and management. You have to understand major procedures, minor procedures, the post-op global package. You have to understand what's all in there. You have to understand the fundamentals of, of course, diagnosis, coding, and things like that. You're coding in the outpatient side, so everything that you are coding for is definitive. It's not anything that is suggestive like the inpatient side can be, but that's a whole nother video. And the thing about it is, when you are going through and you're learning, when you're learning independently as well, you'll know which you're more comfortable with. And you may not be comfortable with coding for the outpatient side and the inpatient side, because the inpatient side is going to also, you have to know all the things that you have to know for the outpatient credential, but you also have to know about the inpatient side if you are wanting to sit for the CCS. And that's what a lot of people don't understand. They see that a lot of employers are asking for it. They ask for it because the CCS is considered to be the mastery medical coding certification. This says that you have mastered not just outpatient coding, ICD-10-CM, CPT, and HCPCS, but it also says that you have mastered ICD-10 PCS. So the procedures for the inpatient side of the house are a lot different than the CPT procedures. When you are coding for the inpatient side, when the patient is staying in the hospital and you're making sure that the facility is getting its money, because the outpatient side ensures that the physician gets their money, but the inpatient side makes sure that the facility gets their money, make sure that they, get paid for the patient's room and board and use of the staff and equipment and supplies and all that good stuff. And that's what the inpatient side makes sure of. So they have to know about DRGs. They have to know about present on admission indicators. They have to know about, again, how to put together the ICD-10 PCS procedure codes. When I say put together, I mean put together, because those, I'm looking at the clock, guys, sorry. I have a few more minutes to do this video and I'm off to my next appointment. So I wanted to go ahead and get this in. But with those procedure codes, you have to be able to put those procedure codes together. Now, some people have told me, Blue, I find the inpatient procedures to be much more understandable for me. I really don't like CPT. I don't feel comfortable with E&M. And to me, E&M is a lot easier and CPT is a lot easier than ICD-10 PCS. But hey, tomato, tomato, okay, it's all the same. It's all coding. But you do have to be proficient in both, okay? Both CPT and ICD-10 PCS if you want to sit for that CCS credential. Now, the benefit of signing up and passing that CCS certification means you can go anywhere. Okay, people are looking for that credential, and they look for that credential because, again, that is the mastery. It is the gold standard of medical coding credentials. There are many people that call other credentials the gold standard, but they cannot touch the CCS. The CCS says that you have mastered inpatient and outpatient coding. And again, there's no other credential that says that. The CCA, the Certified Coding Associate that I had for many, many years, that I will always advocate for, says that you have the entry-level competence to get into the field. But I will say this about the CCA, that has the most domains of any medical coding certification. Domains meaning the unique domains, not like how AAPC has theirs broken down into each section. It's not like that. It is literally like they have the most when it comes to testing of the knowledge for the person who's sitting for the CCA. It is a very difficult credential to get. However, there's a lot of ignorant people out there who think that, oh, it's just entry level, so CCAs can't do anything. Wrong. CCAs can do a lot. And I ran circles around people who had other credentials when I had my CCA. I had my CCA for 13 years. And believe me, it was very difficult for me to give it up, but I did. I got other stuff going on in the background, but my credential was superseded once I got my CCSP, and then when I got my CCS. And I got my CCSP first because, again, I have stuff going on in the background and I needed to move forward. And the only way I knew I was going to be able to do that fast was getting my CCSP. So again, if you are, and the CCSP, just so you guys know, that's saying to everybody, hey, you've mastered that outpatient setting. So, you know, whether you decide to go for the CCSP or you decide to go for the CCS, these are still both credentials that are demanded a lot in the field. They are demanded with a lot of employers. So you have your pick of places to go if you decide to go with either one and you pass your exam. But plan on studying for 20 hours per week. And I say this, and I will keep saying it, only because it's so important to study for these exams. There's a lot of things on these exams, and it's not just the coding, it's also like the reimbursement part, it's also the laws and things like that, like HIPAA and OIG, and you have to know about those things. Those things are very important. But, you know, a lot of people are commenting lately about how they're passing their exams by following my advice. And my advice, again, is to study 20 hours per week. If you put in the time, you will see the results. You will get where you want to go. But if you're not, and if you're planning for your failure, or if you're planning on doing shortcuts because you think that that's the way to go, you're setting yourself up to fail. Okay? And you got to keep this in mind too. What you do, what you select, your knowledge, your know-how is going to affect not just yourself, but it affects your provider. It also affects it also affects the patients most of all, because what you select, and if you select it correctly, then that means everybody's getting their fair share, right? But if you don't, and you undercode or you overcode, guess what happens? The provider loses money, the facility loses money, then they're not able to have all of the equipment that they need and that kind of thing. And patients also suffer too, because having incorrect codes can adversely affect them if they take these records someplace else to another provider who looks at the documentation and looks at the codes that were selected, and maybe not everything was picked up like it was supposed to be, you know, and maybe the patient has to have another procedure again, the same one, because the coder didn't pick it up or the provider didn't document it, and the coder did not educate them like they should have. So there's a lot of these things that go along with, you know, being a good medical coder. But knowing which one, you can't go wrong going with the CCSP or the CCS. It really all depends on where you want to work at. If you end up getting the CCS and you want to work in the outpatient setting, that's totally fine. I do that, and I have the CCS, okay? But I also have the CCSP, okay? So that, you know, either way, I am covered. So, you know, but you just need one, guys. You don't need them both. The only reason that I have them both is because I got the CCSP first. That's the only reason that I have them both, all right? But if you want to start with the CCSP, by all means, go right ahead. There's a lot of people who do that. But that CCS-P does not have inpatient coding on it. So if you find that you don't really understand MSDRGs, but you're really sharp at that CPT coding, and that's the way you want to go with that CCSP. But if you want a chance to code on the inpatient side, then you want to make sure that your CPT coding is up to par as well as your ICD-10 PCS, and then go for that CCS. People pass the CCS all the time because they study. Okay, it's not impossible to pass that test the first time, but you have to study. It's not going to be given to you, just so you guys know. But anyway, I've got to go now. I have another appointment. So I will see y'all next week. I hope y'all have a great weekend. Remember to study hard, and I'll see y'all next time. Please like, subscribe, and share, and I'll see y'all again. Bye.